In 3, 2.
Good morning. Welcome to Thurston County Board of County Commissioners agenda setting work session for Tuesday, January 26, 2021. My name is Ty Menser, Chair of the Board of County Commissioners. Present is Vice Chair Commissioner Gary Edwards. We will be joined imminently by Commissioner Carolina Mejia. Assistant County Manager Robin Campbell is here. Our County Manager is excused this morning, and quite a list of folks from staff that are on the Zoom, and we'll get to them when their items come up. For public attendance, you may follow along on the Thurston County YouTube channel or join by calling 360-252-9020 PIN 1234. And we're going to start, as we typically have the last few months, with a COVID-19 update. We have Dr. Abdo, our County Health Officer, and Shelly Slaughter, our Director of Public Health and Social Services, to handle this item. Robin, is it okay if I go directly to Shelly?
Yeah.
Okay, very good.
Thank you so much. Good morning, Commissioners. Well, today marks day 356 of Thurston County's activation of our incident management team. Here in Washington State, we continue to see COVID-19 cases rise with 302,141 cases of COVID-19 to date and 4,148 people in Washington who have lost their lives. Here in Thurston County, our case counts as of yesterday are 6,185 cases to date, with 356 new cases in the last week. There have been 62 Thurston County residents that have died, with one death occurring in the last week, our youngest to date, 32 years old. 331 Thurston County residents have been hospitalized to date. In our Western region, hospital capacity overall for staffed beds is currently 84.5% capacity, with 13.6 of those beds occupied by COVID-19 patients and 9.3% of ICU beds occupied by COVID-19 patients. Our test positivity rate is 8.6%. There have been 118,591 tests that have been given in Thurston County to date, with 386 of those tests positive in the last week. In terms of our congregate care outbreaks, we've had 42 to date, 6 that we are currently investigating, and 2 that have occurred in the last week. This week, I'm adding vaccine data to my report. I wanted to draw your attention and the public's attention to a new vaccination dashboard at the Washington State Department of Health. It's part of the COVID-19 dashboard that you can see, and there's a tab that you can click that shows state level and county level vaccination data. In Thurston County to date, Thurston County approved vaccine providers have received 13,925 doses of vaccine, with 9,500 being first doses and 4,375 being booster doses. In Thurston County just this week, we are receiving total in Thurston County 1,900 doses of Moderna and 975 of Pfizer. We are committed to 100% allocation and 100% no waste of our vaccine in our community. We estimate there are approximately 70,000 in our current phases. We are still completing phase 1A and working on phase B1 tier 1 at this time. We know there's not enough vaccine supply for everyone, and we thank everyone for their patience. The best way to find out current vaccinations that are available in our community is to check our Thurston County website and also the Washington State Department of Health Phase Finder. We will keep our Thurston County website up to date with available vaccinations. And we also have a phone number for those who may not have internet access or need special assistance in finding available vaccine in our community. And that number is 360-867-2610. 10. We did have many successful vaccination events in the last week that I'm very proud of and very grateful for all of our providers that helped, as well as additional events planned in the next week. Last week, Thurston County Public Health partnered with Providence St. Peter Hospital, where 2,400 doses were administered in a matter of 3 days. At our Lily Road office at Public Health over the weekend, we distributed over 100 doses of vaccine, and we will continue to plan other clinics at Lily Road until our mass vaccination sites are up and running, which I'll share with you in just a moment. We're also grateful for Washington State Department of Health, who tomorrow will be holding a special event just for Panorama City residents. We also have mobile teams and thank our partners at Emergency Management who are helping us to vaccinate adult family homes that have not yet enrolled in the federal vaccine program to get them vaccinated. We also are working on events with Lacey and Olympia Senior Centers, and we will be partnering with our schools when we get to phase B2, which is expected later in March. In terms of our mass vaccination sites that we have planned, we have 2 planned for Thurston County, one at Thurston County Fairgrounds and one at South Puget Sound Community College. Those sites will be up approximately the second week of February. And when we have more information, we will be sharing that on our website as well as at our regular COVID-19 updates. Again, all vaccine events and availability in our community is dependent upon the supply that we receive, and that changes each week. And with that, I will pass it to our health officer, Dr. Abdo, to share additional information about vaccines and anything else that I may have missed in this report. Dr. A.
Good morning, commissioners. We are starting to see in our county a little bit of a decline in our transmission numbers. We are currently at, as a county, 281.7 cases per 100,000 over the past 14 days on the governor's risk assessment dashboard. In our western region, which includes Thurston, Lewis, Grays Harbor, and Pacific counties, our case rates are 360.2 per 100,000 over the past 14 days, which is an 8% decline over the data from the previous week. Hospitalizations in our region are up 14% week on week, and our ICU capacity is at 88%, less than the 90% threshold on the governor's in the governor's metrics, and our percent positivity rate is 9% as a region. However, the other hopeful news is vaccine. We are working, as Director Slaughter shared, on getting all of Thurston County vaccinated in phase. We have been allocated to date, as Director Slaughter shared, 13,925 doses of vaccine. We are so excited to be engaging with our community to get folks vaccinated. However, just wanted to provide a little bit of context in that our estimates, and a lot of these, and these are estimates, that in terms of phase 1A and 1B tier 1, we're looking at about 70,000 folks in our county as meeting those criteria. So we are working as hard as we can and as fast as we can to get everyone vaccinated, but it will likely take weeks to get everyone vaccinated. This has to do with supply of vaccine at a national level. So we are hopeful that when supply increases, we'll be able to work to speed up the vaccination process. But we have all been getting phone calls from folks eager to be vaccinated, and we just ask for everyone's patience as we move forward. I did want to bring up one more one more COVID-related update, and that is the new strain of COVID-19, the B117 strain identified in the UK. Over the weekend, the Department of Health found that there were 2 cases in Snohomish County and announced that based on the UK data, this new strain is more transmissible, meaning that instead of the baseline of 11% of close contacts, meaning individuals that are within 6 feet for 15 minutes or more testing positive during an incubation period, so that 14-day quarantine period, with the new strain, this is 14.7%. Well, 14.7% tested positive based on the UK data. I know there's a lot of work occurring at the national level and at the state level to look at the data and to determine if there's an additional severity of illness that accompanies this strain as well. What I do want to, I do want to let everybody know that that even though these strains are new, there is efficacy of our current vaccines that we're currently using for vaccination. As we learn more, there may be additional boosters or other vaccine processes. But at this point, what we're hearing is that the vaccines that are currently available are effective against this particular strain. And with that, I welcome any questions.
Start with Commissioner Mejia.
Yes, I have a couple of questions. I'll start with you, Dr. A. So with this new strain, I heard that the cloth masks that people are wearing are not really effective. And so I just wanted to see, especially when it came to staff that are having to come in, are we going to order the N95 masks for them? Are we working with departments on preparing for that?
So at this point, different countries are taking different precautions. Right now, we're still, this strain of COVID is transmitted the same way that COVID has been transmitted in the past through droplets and aerosols. It's the difference is less in how it's spread or what blocks it, which is what a mask determines. The difference is really in how tightly it binds to cells once it lands on the mucous membrane, so in your nose or in your mouth. We're in a lot of meetings with our state and our national partners, and as soon as if there is an update in guidance that in terms of the level of protection needed, we'll share that with everyone.
Thank you. My other questions in relation to that Moderna is coming out with a new booster for this new strain of COVID. Could you give us any information on that?
So right now, we are confident that there is significant protection from the existing Moderna vaccine, as well as the existing Pfizer vaccine. One of the really great things about the way these mRNA vaccines work is that because they give your cells instructions on how to make a specific protein that your body develops immunity to after exposure, if there is a change in the protein configuration, like a small change in the protein configuration, which is what the B117 has, you can just snip that piece of the genetic material and make a targeted vaccine very quickly. It's not clear at this time whether that booster is exactly when and how and if that booster will need to be deployed.
Thank you. My other question relays, well, I have a couple, but one of my first questions is for Shelly, and it's in regards to, I've heard basically two strings of information in regards to vaccinating teachers. One of them was that it was actually sent by the superintendent, Chris Rigdal, who said that teachers, he sent out a notice to teachers saying that they qualify under 1B. But I heard right now from you that we won't even get those up until March. Is that correct?
I'll actually defer that question to Dr. Abdo.
Okay.
Dr. Thank you.
So teachers are definitely in 1B due to supply chain. The State Department of Health has broken out the phases of 1B. So there are 4 tiers of 1B. So we are currently working on 1B Tier 1 and all of the Tier 1 and all of the Phase 1A group that hasn't been addressed yet. Tier 1 is over age 65 and over age 50 and in a multi-generational household. So 1B Tier 2 involves our critical infrastructure workers, including teachers. Initially, it was teachers over 50, what the Office of the Superintendent stated, and we of course are very supportive of this, is that to ease in the effective vaccination process, instead of breaking out teachers between age over 50 in tier 2 of 1B and under 50 in tier 4 of 1B, we can bring tier 4 and tier 2 together to vaccinate teachers at that tier 2 phase.
Okay.
However, we're still working through tier 1, which involves a lot of folks in our county. If we get more vaccine allocated to us, we'll be able to move faster.
But at this time, it's not estimated that we're going to be able to serve the B2 until till likely mid-March or later.
My next question, one second. My next question, I spoke with several community partners last week, and I was disappointed to see that we were not really reaching out to them and working with them. One of the partners I spoke to were Medic One, and they said that they would love to help in this. They had 2 vaccination sites, both in the Lacey and Tumwater fire stations, and they said it worked very effortlessly. Another was with the South Sound seniors as well as Intercity Transit about the delay in getting back to them. And so this is more of a motivation to Shelly to really reach out to those partners. I know you're working with South Sound seniors now, but really reach out to them and use the resources that we have available in the community. We need to really work together now more than ever.
Thank you so much, Commissioner. I wholeheartedly agree. Partnerships are key to the success. It is going to take our entire community and it's going to take our whole village to get all 290,000+ Thurston County residents vaccinated. We have been working with all the partners that you named. For example, as I stated, Medic One and EMS providers, and thanks to coordination from Director Kurt Harden, has helped us to connect those providers to help us vaccinate adult family homes this week. And they will also be helping us in our mass vaccination site. So we are definitely working with them and welcome more. In terms of South Sound Senior Services, yes, we are planning events with both Lacey and Olympia Senior Center. I know that our vaccine coordinator and incident commander has been in communication with them to talk about those plans and ways in which we can partner to make sure that we're reaching especially those over age 65 in our community right now. Intercity Transit, Dr. Abdo and I met with their director this week and worked on some plans to help support those of their drivers that qualify for 1A now. So these are all very important partners and very important populations that we want to serve. And also I do commend Providence Medical Group as well as Thurston County Emergency Management and all of the EMS providers who coordinated on the successful drive-through event out at Lacey Fire Station 34. We will continue to find and identify new partners. Thank you.
Thank you.
Mr. Edwards.
Yes, I guess I want to follow up on a couple things that Commissioner Mejia brought out. I talked with, it was South Sound on Friday afternoon, and they hadn't been contacted. So did you develop all this stuff over the weekend? Is that you're now lined up with those folks?
I believe that our incident commander did talk to them over the weekend and even as recently as yesterday, but I think conversations had been happening prior to that as well, but I can definitely verify that. Nevertheless, it's an absolutely essential partnership for us to be working with them. And
I understand that like St. Martin's College, did you contact them about using their big gym or anything? I know they were interested in helping, but I don't think anybody got back to them either, I don't think, but maybe you've done it over the weekend, I don't know.
Well, we are in contact. We're definitely in contact with St. Martin's. They have generously offered us the use of the gym. Right now, the limitation on mass vaccination efforts is availability of vaccine. And I am so grateful for all of the wonderful Thurston County partners who've stepped forward to assist us. And I do, as we have more vaccine available, I do look forward to utilizing more of our spaces and collaborating with more of our partners.
We have had lots of generous offers from people in the community offering space. And another partnership that I forgot to mention is one that we're developing with United Way of Thurston County, who is offering to help to coordinate all of our volunteers for our mass vaccination site. So we're really grateful and excited about that new partnership as well.
I guess just to follow up there on the school openings, it doesn't sound like we've got that under control yet because the teachers are saying they're not going back until they get vaccinated. Now we can't vaccinate them until into March sometime. Is that the way I took that?
So at this time, Thurston County is, as it has been throughout the pandemic, in alignment with the Washington State Department of Health guidance in terms of decision making on school reopening. We are, of course, in communication with the superintendents. We wholeheartedly support the vaccination of teachers in phase. Right now, that phase is phase B2. And we're able to do both B2 and B4 at the same time. We have identified vaccination sites when vaccine becomes available for educators in tier B2 at schools throughout our community. Honestly, the exact timeline has to do with the amount of vaccine that we're allocated. If there's an increase in supply of vaccine, either through increased supply of Moderna and Pfizer, or through the approval of additional vaccines from Johnson & Johnson or AstraZeneca, then I anticipate that we would be able to vaccinate considerably faster, and we would be able to move on to tier 2 much faster.
How about for restaurant owners? I'll just use those because they're in the news lately, but are we getting any closer to be able to open up 25% or 50% or whatever? Do you have a date that you can actually point to that you might be there? I mean, they've been getting extended by a couple of weeks at a time since I don't know when, and I doubt they can keep going. Do you have any more information on that issue?
So the way the roadmap to recovery metrics are is it's a trend base. There isn't an absolute cutoff. This week we were looking good with everything except for our increase in hospitalizations. We still would need a greater increase, a greater reduction in our case rates because we were down 8%. We'll need to be down a bit more than that. And our hospitalizations were up, but those were the two things that were holding us back from moving on into phase 2 as a region this past week. Because all of this is trends and it's dynamic and there isn't a hard cutoff, it's not possible to give a date.
And I'll just add that Washington State Department of Health makes that decision based upon the regional data, and they notify us as a county every Friday as to what our status is. And if our status changes and we're able to advance to phase 2, it would take effect on the Monday following.
So for sure that it won't be until the soonest it could be would be next week. Is that what I'm hearing? If everything went perfect?
Yes.
Okay. Are we doing anything about homebound seniors? We've got Meals for Wheels, service. Those folks aren't coming into the senior centers anymore. So have we developed any type of a contact, or can we go out and give those folks a shot at the same time we give them a meal or something like that? Or is there something in the works to watch out for those homebound seniors?
That is definitely a high priority for us. We want to reach those who are underserved and unable to access vaccine, and we want to bring vaccine to them. So our mobile vaccine efforts are in motion this week, and over the next several weeks, that's going to be a priority for us to reach all of those that qualify right now that aren't able to, and to include partnerships like that.
Shelly, you mentioned that we gave some shots over at the health department. Do we store that serum or vaccine? Do we store that over there, or do we have that capability, or do we check out, 100 shots or something from the hospital? How does that work out?
Thurston County Public Health is a registered approved vaccine provider by Washington State Department of Health. And so we do receive our own allocation of vaccine each week.
Okay, then that has to be used up during that week, is that it?
That's right. We are committed to using 100% of our vaccine each week.
Okay, just one other thing real quick. Blood Works Northwest, I see they put quite a few ads on TV. They're looking for blood. Do you suppose that they would tell people that they've either had the virus at some past or that they are infected? Is that part of our count of information that we're getting back? I mean, if I go give blood, will they tell me, well, you've already got the antibody or whatever? Or, hey, we can't use your blood because you got the virus, get out of here. So are we coordinating with some of that activity as well?
So in terms of blood tests for COVID-19, you can really only detect with what's currently available in terms of lab technology, we can really only detect antibodies, and that would be a signifier of past infection. BloodWorks Northwest has been notifying folks of their antibody status. That does provide useful information in terms of past infection. It doesn't really affect our understanding of the current pandemic dynamics, where PCR testing is the gold standard and antigen testing also helps us get rapid results.
Okay, thank you.
Okay, thanks. I have a few questions. We're running long on this segment, so I'll try to make my questions short and maybe you guys can be as concise as you can with your answers. Simple questions. The 8.6 positivity rate that is reported weekly, is that over a week's time or 2 weeks' time? What is that time period that number covers?
That is in a 7-day period from Sunday through Saturday each week.
Perfect. You gave out a number, 360-867-2610. What is that number? I didn't catch what people call that number to find out.
if anyone needs help finding out information about vaccines, if they do not have access to the internet or a website and they would like help either finding a vaccine clinic, asking a question about if they're eligible, or if they need help signing up for a vaccine clinic, we can do that for them.
Okay. The number that you gave, 281 cases per 100,000 over 14 days, is that the number that, I'm just trying to clarify, is that the number that your recommendation, for example, about high schools was that's going to need to be under 200? Is that the number we're talking about, the same number?
Yes.
Okay, that's all I need to know. Today's conversation obviously shows that the public interest topic of the week has shifted from schools to vaccines. And I've gotten a lot of input, some of the same stuff that sounds like Commissioners Edwards and Mejia have gotten. This production delay or supply, I mean, can you, taking this up to a higher level, national level, like I just haven't heard in the news articles and news reports, what is the exact issue of Pfizer and Moderna? Are they shipping more out to other countries, or did they they overestimated what they could produce over what period of time? Is there a good explanation as to why the supply is coming slower than we anticipated?
I am not certain of that answer. I know that Washington, the entire state of Washington, only received 100,000 doses last week. And it is allocated from the federal government per population for each state. And then the state sets priorities in terms of how they will vaccinate that supply each week as well. We're very hopeful that vaccine supply is going to increase in the next couple of weeks, but that remains to be seen yet. But that piece is not, unfortunately, in our control.
No, it's not in our control. I mean, I've been getting a lot of input about concerns about how Thurston County is distributing the vaccine, but my understanding, and you're confirming, that it's really not about, we can set up a clinic in St. Martin's and we've got mass, clinic sites ready to go, but we don't have the actual vaccine. So I haven't been able to explain to those people why, kind of at a higher level, why are we not getting the supply? And I watch national news, and I read newspaper articles, and it doesn't seem to be, it seems like the question that needs to be answered that's not being answered, but that's fine. So along those lines though, like Clark County, I read in newspapers, like got FEMA involved to and in order to, I don't know exactly what they're doing, but I guess my question is, if we don't have the supply, what is FEMA helping Clark County do that we're not doing, or we're not ready to do? Why would they do that if they don't actually have vaccine? That kind of confused me. I don't know if you saw that article about Clark County trying to set up, I think it's just trying to be ready for, the influx of lots of doses. Is that what they're trying to accomplish?
I know that all local health jurisdictions are working on implementing their mass vaccination plans, and some have some already operating, and the governor's office announced this week for mass vaccination sites located in the state of Washington, one of those being in Clark County, and that is being supported by the National Guard, and state vaccination allocation supply and resources are going to help support those 4 major sites in the county over this next week to get those up and running. But yes, everyone is working on being prepared so that when we have the supply, we can get it into as many arms as quickly as possible.
Thank you. And it sounds like that clarified something for me, because it sounds like somebody probably heard about that and thought Clark County was, Johnny on the spot being proactive, but it sounds like that was kind of directed by the state and selected that location and organized National Guard and et cetera. Okay. I think that's most of my list. I just mainly wanted to also, since Commissioner Edwards mentioned teachers, it's not accurate that teachers aren't going back to work. My wife will be back in the classroom Monday as a kindergarten teacher in Olympia School District in a hybrid model, and her entire all the kindergartners at her school will have the choice to be back in the classroom 2 days a week on the hybrid model, or they have a choice to stick with distance learning. And one of the 4 kindergarten teachers is sticking with that model. I just didn't want people to have the impression. The teachers union did suggest that we should all, all the teachers should be vaccinated, as the Florida County Commissioners did. But at least with Olympia School District, which is the one I'm familiar with because my kids are there and my wife is an employee there, the teachers have not failed to answer the call of what the school districts have laid out, and school is starting under this hybrid model next week for the younger kids. Thank you, guys. Appreciate your time this morning.
Thank you so much, Commissioners.
Thank you.
Okay, next we have Keely Marino and homeless strategy update. Keely, as concise as possible, if you could.
I got your back. Good morning, Commissioners. Keely Marino with Public Health and Social Services. Really, the most important and only update I have for you today is a reminder that the point in time count for 2021 is occurring this week. The official night that we are counting is Thursday, and we have unsheltered individuals being only counted via anonymous head count this year. And we will be relying on homeless management information systems data to be giving us our sheltered count and our transitional housing count. It should be pretty smooth. We do not have a need for volunteers this year. Please, if you're interested in volunteering, hit us up next year where we intend to, I'm assuming, move forward with a regular count. By this time next week, I should be able to give you an update on how the process went, and I'm not going to promise preliminary numbers, but I will certainly be able to update you on how the whole process went, as it is a very unusual year for the PIT.
Is that it?
That's it.
Okay, questions on that issue from commissioners?
I have no questions.
Commissioner Edwards?
No, sir. I do not.
Okay,
Either.
thank you, Keely. I just have one.
Okay.
So you said preliminary numbers are, given that the data is coming in a different form, is it going to be, are you going to do your full, scale? Usually we, there's a fancy report and dashboard metrics and all that. Is that being sort of scaled back because of the different amount of data, or is that going to happen in the same way?
It will be scaled back. However, the data that will be deduplicated is all coming from Homeless Management Information System database, which the State Department of Commerce will have to deduplicate. We'll be able to pull out our preliminary numbers. Talking with Ariel Benson, our coordinator for this year out of our office, she's anticipating having some kind of preliminary count by the 12th of February. That's subject to whatever strange circumstance may occur, but we should have a decent understanding of what the numbers are by the 12th. Official reporting is determined by Department of Commerce's turnaround. So,
thank you so much, Keely.
You bet.
Okay, item 3 on today's agenda is to review this afternoon's draft agenda, which we reviewed last week, but we'll review again, make sure everybody is square. The meeting will be called to order at 2 p.m. Pledge of Allegiance to be led by Commissioner Edwards. We will contemplate approval of the agenda and board meeting minutes from 12th and the 19th of January. Opportunity for public to address the board is item number 1. And County Manager's update, Robin Campbell. You're our County Manager du jour. Do you have anything that you'll be reporting on under item 2?
Nothing this afternoon.
Okay, so then we'll jump to consent piece, which is items 3A through 3G. Okay, number 1 is delegation of signature authority to the County Manager.
Yes, Commissioner. Here we go. So every year, the county provides certification to the County Road Administration Board of certain items that we're required to do, such as certification of diversion of road funds, certification of expenditures on fish passage barrier removal, and overall annual certification to the County Road Administration Board. In exchange, the county receives a certification from CRAB for the standards of good practice, and that enables the county to receive state and federal funds. The county manager has been signing these certifications for many years, but last year CRAB requested a formal delegation from the Board of County Commissioners delegating authority to the county manager to sign. So this motion is your delegation of authority to County Manager Chavez to be able to sign these certifications.
Any questions on this item from the board?
No, Chair, I don't have a question on that, but I would like to just comment on something. Under summary of timed items, we show a public hearing at 3 o'clock, and I don't have that on my calendar, and I just wondering.
That is a good catch. You're right. I do not have that on my calendar either. So is that just a artifact, remnant of a previous draft?
That must be from last week. We'll get that off.
Okay.
Thank you for that catch.
No, thank you.
I'm not aware of a public hearing this afternoon.
No, that was it, sir.
Commissioner
questions.
Mejia, anything?
No questions for me.
Okay, let's move to item 3B,
This,
Public Works item regarding appointment to Solid Waste Advisory Committee.
I must not have the most current agenda. I apologize.
I think Karen's here, Karen Weiss, and she's the listed. Karen, can you maybe just slot in and cover this for us?
Yes, thank you. Karen Weiss, Interim Solid Waste Manager, Thurston County Public Works. We have received a letter from the City of Tenino that is nominating Cutter Copeland as to fill the position, an open position that was left from somebody who resigned from the position to fill the remaining term, which I believe is through January of 2022. And so we had received a nomination letter from the City of Tenino, and this is to fill that open position with the Solid Waste Advisory Committee. So.
Questions on this for Karen?
No, sir.
Yeah, it would be extremely unusual for us to not adopt the recommendation of a municipality that had their own seat and made a selection. So I don't have any problem with this item. Commissioner Mejia, you good?
No, sir. Yeah, I don't have any comment.
Great. So let's move. Thank you, Karen.
Thank you.
That'll be on the consent agenda under 3B. We'll go to 3C, which is an assessor's item, resolution to classify a position in the county pay and classification pay plan.
Thank you. That'll teach me to not find the most recent documents. So the assessor, as you are aware, has an ongoing effort to manage his office. And this is one item where he will be reclassing a senior appraiser position to an appraiser assistant as a new hire. And then once that new person becomes qualified, in about a year, he'll ask to reclass it back up.
Questions on this item, Commissioner Mejia?
No questions.
No, sir.
Okay, very good. I do not either. Let's go to 3D, Public Health and Social Services, a similar type of item regarding a resolution extending a position under the pay and classification plan.
Yes, this is a nurse family partnership program position. It had an end date, and we are requesting the board to extend the end date through the end of this year.
Shelly, did you have any detail? I do remember this item, but if you want to explain exactly what the what the justification is?
Yes, we have funding available for this position through the end of the year, and this position formally had an end date that was midway through our fiscal year. So this position, we're requesting that it be extended. It is a grant-funded position, but we do have funding throughout this duration of time. Gretchen, did I get that correct?
Yes, spot on. And we have a big need. So
Okay, thank you,
continue that
Gretchen.
waiting list. So we'd love to have it continue.
Questions for Gretchen or Shelly from the board?
No, sir.
No, sir.
Okay, thank you. We'll have that under 3D for this afternoon. 3E is a treasurer item regarding the sale of tax title property via public auction, which we reviewed last week, I believe.
Yes. This item is a request from the treasurer. As you know, Treasurer Gadman is actively taking steps to sell the many tax title properties that Thurston County owns. He received a request for this specific parcel, and our permitting center has determined that this land is buildable, so it needs to be sold as auction. This item authorizes the treasurer to hold an auction and then sell the property to the winning bidder.
Any questions on this item?
Yes, I have a question.
Go ahead, Commissioner.
What is the date of the sale on this particular item coming up? This, I think, is one down in Rochester, if I remember right, when we went over it a week or so ago.
Right, that's where the property is. I don't have the date of the sale handy, but I can get that for you.
I guess I only ask that it be included in the motion here, just so that the public will be able to know when to pay attention.
I don't know that the treasurer has set the date yet, but we can find that out.
Even that would be okay if we would just make notice that the public will be notified prior to, or something like that. That's all.
We are required by law to notify the public of when the bid will be and when the auction will be held. It'll be in the paper, it'll be on the website.
Okay.
There are many ways that we notice, but I will check to see if it's been scheduled.
Thank you.
Commissioner Mejia, anything on this item?
No, I have no questions. Thank you.
Okay, very good. That brings us to 3F and G, which are the financial services voucher lists. Do commissioners have any items they want to bring to attention of the board or staff on those two?
No comment from me.
I don't have any.
Okay. So that will cover this afternoon. We now move to department items. Item 4 is community planning and economic development. Resolution regarding illegal discriminatory language in residential recording instruments. Jeremy Davis is here. And Robin, you can set it up, or I can pass it off to Jeremy.
I can try to set it up. So this is an item that you've seen before. We have found that there is language in some of our documents that establish plats for our real property that is discriminatory. So this motion will move that the board affirms that such language has no place in our community and supports the actions of people to find and rectify such language. The language is certainly not legal nor enforceable, but this just affirms the position of the county that it is abhorrent that it's even there at all. So Jeremy, if you'd like to add anything to that.
I'm sure. Good morning, Chair Menzer, Commissioners. Jeremy Davis, Operations Manager for Community Planning and Economic Development. As Assistant County Manager Campbell indicated, I'm here to request the board consider a resolution concurring that these discriminatory restrictive covenant language in real property instruments is illegal, and again, to encourage citizens and property owners to look for these and to try and rectify this issue through whatever available means there are in state law. And included in the resolution that's before you today is just a short summary of the history behind such racially discriminatory language in our covenants, provisions, loan documents, and other such legal documentation, and also a short history of some of the local and national efforts to remove and repeal such language in our local instruments. And just for time crunch sake, and I could go into more detail if the board desires, but to my knowledge, at least, there are three main methods to remove these provisions from real property records. One of them includes a law brought in 1987, which is RCW 4960-227, which allows a private property owner to go to Superior Court to remove and strike such covenants. Another one was passed in 2006 that allows a homeowners association board to, by simple majority vote, remove such provisions from their governing documents. And also, there was a law passed in 2018 that actually simplified the process for property owners greatly. And this was Senate House Bill 2514, which amended RCW 4960-227 to allow real property recording instrument records to be modified by recording a restrictive covenant modification document with the county auditor's office free of charge. And that's for any such property to do that. Now, all of these methods, as well as past court cases, don't actually remove this harmful language from our historic record. That language does remain on the books, and there's no such method at this time to remove that language from the historic record. But it does modify the property title so that when a title company does a search, it shows that it no longer applies to that property. And if there are any questions to the board, I'd be happy to answer anything you have.
Yes, I have a question.
Go ahead, Commissioner Edwards.
I agree, we got to get rid of this. But on your fifth sentence from the bottom, illegal and unconstitutional and further move to support the work of citizens. I just wonder, does support mean that we're going to get financially involved, or could it mean that because some of these changes get pretty complicated on these homeowner situations. And I just wonder if it wouldn't read better to have it illegal and unconstitutional and further move to encourage the work of citizens, property owners, and homeowners. I'm just trying to get out of any future financial situation that somebody might come and say, hey, you said you were going to support this, doing this. This is going to take whatever it takes. I'm just trying to think ahead. I agree it needs to go. Just looking for that word change. I don't know if it was reviewed by our council yet, but just a suggestion. Do you know, Jeremy, did legal go over this? They think
Yes,
support's better.
Yes, sir. Legal did actually review the draft resolution before it was brought to the Board of County Commissioners.
And if that's the pleasure of the board, then we can.
I mean, we mean the same thing. We want to get it fixed. No two ways about it. I don't want somebody coming back a year from now and saying, God, we couldn't change our bylaws and we're going to have an attorney to go to court. We don't have any money. And I don't know. I would hope that encourage means the same thing without the possibility of financial commitment. That's all. So
Are the other commissioners amenable?
I'd like to hear from our chair, to be honest with you.
Well, I think we're looking at section 2 of the resolution, which says the board hereby supports the work of citizens, real property owners, homeowners associations, and other interested parties to find and rectify such discriminatory or restrictive language in all real property and plat recording instruments in Thurston County. I'm looking at Jeremy and Josh. That's the section that Commissioner Edwards is keying in on. So the question is, can we get to the same point without using the word support, is my understanding of the suggestion. The board hereby encourages the work of citizens. I don't know, Commissioner Mejia, do you have an opinion? Does that achieve the same goal from your perspective?
I don't see a big difference, honestly. I mean, if, I mean, support can mean different things for me. But if that makes Commissioner Edwards more comfortable, I'm fine with that.
Well, I'm not necessarily uncomfortable. We want to do it. I just was worried about a future financial obligation that.
Yeah, I mean, we're certainly not, I don't think we mean financial obligation by using the word support. So I guess I can see that encourage is maybe less likely to be construed that way. I don't know, Jeremy, does that feel like it still gets the goal you were shooting at?
So, Jeremy,
Or does it weaken it from your perspective?
it does not weaken it. This is at the direction of the Board of County Commissioners, and I believe that your dialogue on support is correct, that encourage is the likely meaning of support.
Okay, well, I'm okay with that. You know, one thing I wanted the board to know is I'm now the county's rep on the Wasatch Legislative Steering Committee, and one of the bills that was ticked through was HB 1335, which is a bill that is going further than what we're doing, I think. Wasatch has concerns about it because of unfunded mandate considerations. It's requiring more of an affirmative. I didn't quite get the gist of, or the details of what it requires, because we go through those really fast, but it deals with these, you know, these types of provisions in deeds. It has a notification process requirement. I made a note to talk to our county auditor about what the costs and the work would be involved in case the board is asked to take a position on it. Eric Johnson, who's the director there, I put in the chat that Thurston County, because some people in the chat were saying, we don't have anything like this. And then other counties were like, oh yeah, we found a whole bunch. And I said, yeah, we've found a number of them recently, and we're taking we're doing a resolution. And Eric wanted to see what we're doing because they would like to be able to argue that, you know, the state doesn't need to require everybody to do one thing. Local jurisdictions who have the problem are dealing with it on a local level, and they wanted to use our draft, which we may be passing today, as an example of what local jurisdictions can do on a local level. But looking at what we've got here versus what was explained, I think, Jeremy, are you familiar with 1335? Do you know what it does that's beyond what we're doing?
We'd certainly be more than happy to look into. From what I understand, it has to do with the timing of our comprehensive plan updates and does call out some specific funding sources, which I would have to look into, sir.
Okay, no problem. I just was curious if you'd seen it. I just want the board to be aware of this, that I think it's fine for us to do what we're doing. I don't think it's going to interfere in any way with what may be coming in this legislation. I don't know if this legislation is likely to pass, but I guess what I'm saying is we may get superseded in some way by a state law that's going to require a more affirmative set of steps to try to root out these types of provisions. And it was interesting, in Pierce County, they're working on it as well. And they described how they're finding, because they said, whether you have them or not, it depends on when certain areas developed. Apparently, this came in vogue in a certain little window of time, like the late 40s and early 50s or something. And so if you have a neighborhood that developed during that window, you're very likely to see this. If you had, subdivisions before that, it wasn't in there. But they're popping up in a certain wave of development that happened. So some counties are not seeing it at all because they just didn't have development wave during that particular window. Josh?
I just wanted to say thank you for pointing that out. And so real quick, Joshua Cummings, the Director of Community Planning and Economic Development. I'd like to take just a quick moment to commend the Board of County Commissioners and leadership. When this was brought to the board's attention, the board took swift action to direct our staff to find a way to acknowledge it. As Jeremy stated, we're not deleting our history, but we are definitely acknowledging the mistakes of the past. And so very much appreciate the opportunity to do this work. And Jeremy has done an excellent job of making sure that we do it in the right way, that is clear and consistent. and we look forward to taking next steps.
Okay, so with Commissioner Edwards' approved language change, are we comfortable with having this on today's agenda?
I'm very comfortable with having it. Sooner the better. I'd like to lead the pack.
Okay, and I will send this, and then once we do that, take that action, I'll send it to WASAC for them to look at and see what, if they'd like to use it as some kind of a, effort in what they're trying to do. I don't have a position personally on 1335 yet, because I need to know more about it, but there was a concern that it was going to cost counties money, there was certainly no objection to the policy of trying to deal with these provisions. Okay, let's go then to, thank you, Jeremy and Josh.
Chair.
That's our CPED item for today. Let's go to item 5, Public Health and Social Services, Healthcare Authority contract regarding the lead pilot site development.
This action will approve a county contract for the Law Enforcement Assisted Diversion Grant. We would accept the grant and implement the program here in Thurston County. This provides another tool for our criminal justice system to work with people in need in our community. And this funding is approved in the budget and we'll match it with treatment sales tax funds to be able to stand the program up.
Marianne O'Garrow's here, and she's been front and center on this for public health. Can you, anything else you wanted to add? I know we've covered this item a number of times.
No, that's pretty much the summary.
Okay, great. Commissioner Mejia, anything?
I have no questions.
Commissioner Evans?
No, sir.
Very excited about this. Thank you, Marianne. We'll see you this afternoon. And Carrie Hennon, our Director of TST, thank you for your support of this, and we'll hopefully approve this afternoon. Thank you. Next is 5B, 2021 Treatment Sales Tax Interlocal Agreement with Thurston Mason Behavioral Health Administrative Services Organization. And Carrie Hennon is here. And Robin, anything you want to say on this?
Yes, the county has a long-standing partnership with the Thurston Mason Behavioral Health Administration Services Organization to provide treatment services for behavioral health to people in our community. This contract will be for the county to pay the BHASO $2.5 million in treatment sales tax funds for this year, the current year of services. And this funding is approved. It was reviewed by the board during the budget process and approved in the budget.
Carrie, anything to add to that?
I guess the only thing I'd add is that I believe that's to be spent here in Thurston County, and I believe Mason has their own funding source. It just doesn't say so. It could be confusing to the citizens if we're, carrying the ball for somebody else.
That is correct, Commissioner. This is Thurston County money that will be spent on Thurston County clients.
Carrie, did you have anything to add there? No?
Nothing to add. Good summary. Okay. I think we've covered this one before. Thanks.
Very good. Commissioner Mejia?
I have no questions. Thank you.
Carrie, is there any, Robin made the point that I wanted to make, that the allocation of this money was considered during our budget, where we reviewed the recommendations of the advisory committee and kind of dialed up the different programs. And this is just sort of the inking of the legal, following through on that item that the board made a decision on in the fall. Is that correct?
Correct. Yes, exactly.
Okay, very good. Just want public to understand we're not just, handing $2.5 million checks out. This was gone through very carefully during the fall. Okay, thank you.
Thank you.
Public Works is next. Now, item 6, there's 2 items under Public Works. 6A is interagency services agreement with Washington State Department of Fish and Wildlife for Boston Harbor.
Yes, we have a park in the Boston Harbor area. It is owned by the Washington State Department of Fish and Wildlife. The county enters into an agreement with the state to provide maintenance at the park. We clean the bathrooms and collect the garbage. The work is minimal, in part because this park is very nearby one of our county parks. We're able to do the maintenance at the same time as we take care of our own parks. And that enables us to keep this park open and available to the public, because the state has said that they do not have the resources to be able to maintain the park. They pay us $5,000 per year, and I'd be happy to answer any questions that you may have. And we also have Lucy on to answer questions if you have them.
Lucy Mills, Road Operations Manager, welcome. Commissioners, any questions on this item? Commissioner Mejia.
I do not have questions.
I don't have questions either, sir.
Okay, I don't not either, Lucy. Thank you for being here, and that item will be on this afternoon's agenda. 6B, resolution vacating unopened rights-of-way in the plat of Boston Harbor. Craig Sisson, Real Estate Services Manager, is with us.
Right. So on this item, the board held a public hearing on November 10th regarding the vacation of the county's right-of-way. And it appears to be at 69th Avenue in 7th Ave South. And what we are proposing is that the county vacates the right-of-way and the property rights revert to the owners. And Craig can tell us more about this.
Absolutely. Good morning, Commissioners. Craig Sisson, Real Estate Services Manager for Public Works. I'm here to answer any questions you have on this.
Commissioners?
I guess the only thing I would comment on, this is something from 100 years ago or something, isn't it, Craig?
Correct. The plat was recorded in 1907.
Yeah, okay, that's the one.
And we've received no public comment from the hearing.
Correct.
That was my question, so thank you.
Very good. I have nothing either. Thank you, Craig.
Thank you.
Item 7, County Manager category. This is a description is a COVID-19 vaccine contracts. Robin, did we review this last week? This is
No,
new.
This is a new item, Commissioners. As you heard earlier this morning, we are working very hard to stand up our vaccine distribution sites, and that will require us to partner with many others in our community providers, doctors, and have people available who can actually administer the vaccine. What we're asking you to do this afternoon is to authorize a waiver from competitive bidding so that we can award personal service contracts to providers who are qualified to administer shots. And we would be able then to expedite contracts with these providers and more quickly enable our vaccine sites. So this would also delegate to either the county manager or the assistant county manager, depending on who is available at any given time, the ability to sign the contracts under our emergency order.
I do have a question.
Shelly's here to answer questions. Commissioner Edwards, go ahead.
I'm just going to use an example. I know the auditor's office contracts with, I'll just say Heddon's Pharmacy in Tenino to do licensing issues. And then they get like, I don't know, 50 cents for each one they do. And I'm wondering, is that going to be something similar to what we're proposing here? Because you can go into Heddon's, I think, and get a flu shot, you know, or at Tim's Pharmacy or something like that. Any of the pharmacies, I think, do it. So are we kind of leaning that way to where we be able to get more community outreach through those type of organizations? Is that where you're headed with this? I'm all for it. I just wonder about it, you know, because I'll get asked questions is all.
The primary purpose of this is to contract with medical staffing providers that can help to support our mass vaccination sites, as well as augment our mobile vaccination efforts. In Thurston County, between our Medical Reserve Corps and our Nurse Family Partnership nurses who normally work in another program, we have a limited number of public health staff that have the credentials to actually provide vaccine. We are leveraging volunteers to every extent possible, but in order to vaccinate the large number of residents quickly, we need to be able to contract, have the ability to contract with other providers to help us do that. In terms of pharmacy vaccinations, the state of Washington is prioritizing getting vaccines to pharmacies, but that relationship isn't happening through local public health. So at this time, we wouldn't be paying pharmacies, for example, to vaccinate, but we would be paying for other staffing agencies and organizations that employ medical staff to help us.
Okay, I mean, I want to help, and I don't want to hinder or slow anything down, but I mean, it just coming through with the same day makes me wonder. But this is an emergency, so I guess
we are moving very quickly.
Yeah, I don't have a problem with it. I would just hope that we would not limit ourselves as we move forward. Say there's a couple more vaccines become available, Johnson & Johnson gets their thing out or whatever, and it doesn't take quite the requirements and stuff. So I'd hate to see us limit our ability to do this at a future date. I'm hoping this will help that.
Right. This actually expands our abilities and removes some limitations.
Okay.
Because it'll enable us to be able to pay medical providers to administer those shots in ways that the state is not directly reaching out.
Sorry. I have a question in regards to cost. I mean, there's not a limit here in regards to cost or something that so do we have an estimate or anything like that? Or do we have a limit?
So we hesitated to put a limit on this motion. At this point in time, the priority is rolling out these vaccines. And the funding has been promised by the state and the federal government. We don't have it in hand yet, but we know that it will come. So I didn't have a good sense. Shelly, do you have a sense of how high these contracts might go? It depends on how big the provider is.
That's right. We right now are meeting with different providers to try to develop what those costs could possibly be. But for example, a nurse that can administer vaccines, the going rate is approximately $100 an hour. We're able to get the vaccine supplies and the vaccine itself at no cost, but the medical staffing again is what is rather expensive. And when we're talking about doing something like 1,000 doses a day, which would be our goal once the supply is flowing, and maybe even more if we're able to do that. You have, 8-hour shifts and multiple vaccinators that you need to have on hand, as well as the support staff for that. So I don't have an exact estimate yet to provide you as to what that might cost, but I do appreciate the board's consideration of the urgency of this request to help us secure this medical staffing, because it has a very high premium and very competitive right now, because every other local health jurisdiction in the state is trying to do the same thing.
I would also add that last I heard, Shelly might have an update, but last I heard, the overarching estimate for the vaccination process is $12 million. So we're looking at spending a substantial amount of money, and a chunk of that will be to secure these providers.
Okay, Chair, could I make one more comment, please?
Yes, sir.
I know you folks are well-intended, but I, like Commissioner Mejia, was disappointed that we hadn't had adequate outreach to some of these organizations, or at least callbacks to them, to say this will work or it won't work or thank you or whatever. And I know you guys are working hard to get your job done. My concern is that we jump into this that quick with a bunch of unknowns, and we all know everything is well intended, but then something goes awry. Somebody misses somebody that's volunteering, and then their nose is out of joint because, well, how come I didn't get called back? Or I'm just, I very much want to help you get there, but on the other hand, I see restrictions in place that I don't even understand. I mean, if a pharmacist can give a shot, to a person for the flu coming in, and we hear this is all about, this is kind of a flu, but we want to watch for side effects or whatever. I don't want to do anything that limits us or would be more preferential to one group than another, because, we're taking that competitive bidding thing. And I'm not saying anything would, I'm just saying mistakes happen. I'm just nervous about it, that's all. And what is the time frame? If we do this today, do we have the equipment? Have we got the grants through? Have we got some ideas what we're gonna put in place right now? Or has it been vetted properly? That's all I'm asking. I'm just looking for some insurance or assurance, I guess, that we're getting it right.
Absolutely, Commissioner Edwards. I wholeheartedly agree with you. One of the things that is really important to us is equity and making sure that we have equitable access to everyone in our community, and that we're not exhibiting any kind of preferential treatment to anyone. We are partnering with our healthcare providers and our vaccine providers that have been approved thus far. We hope that there will be more, but what we know for the vaccine providers that we have in Thurston County, it is still not going to be enough to get all of our Thurston County residents vaccinated. It is going to fall to local health jurisdictions to help make this happen through those mass vaccination sites. And our priority will be to utilize our existing county resources, county staff, and volunteers to every extent possible. We just want to be ready. We have to have our mass vaccination plans secured, and we can't do that without the staffing. So this is a key piece that we need to make sure that we are able to do, so that we have that flexibility to be able to quickly staff up and get vaccinations should that supply arrive. We need to act within 7 days. That is our requirement, that is our commitment, but we can't do that without having people ready to go. And all of our healthcare providers in Thurston County and everywhere are very overwhelmed, and they're asking us for help as well. So,
but it doesn't sound like we even have the vaccine available to do what we're trying to do. I realize we're trying to get there and make sure we're prepared when we do get it. But it seems like, I mean, we've got a lot of people to reach out there, and I think we ought to be using the pharmacist, the dentist, the school nurse, everybody that we can utilize. And I hate to see us miss the boat on something. And that's where my concern is, that we're too restrictive, it seems like, to me, on getting this done. I want everybody to be able to utilize it. So that's my concern as well.
Commissioner, that's exactly what this motion does. It enables our health department to contract with a multitude of providers without having to go through a competitive process. And we don't see just one contract awarded. This will be many, many small contracts with people. The school nurse who's got the time to come, and we'll pay her for her time. The doctor's office who reached out to us and say, I have nurses to deploy to this, but they need to be paid for their time. This enables us to use as many people on a small contract as possible without getting audit findings for not following our procurement policy. We are trying to cut through the red tape with this action.
Okay, that's good to hear. Thank you.
Yeah, we also can create a list of all of the contracts that we award and report those to you along with the other COVID report items on Tuesday mornings.
Thank you.
I have a comment, if Chair, or an extra question. My question relates to, Shelly mentioned the mass vaccination site plan. I would like to see that, please. If you could send that to me, hopefully before we go into this afternoon. And then I'm wondering why we're not, I know we need providers, and I do see the need for this, but why are we also not contacting, the private providers that have their own clinics, and why are we not distributing vaccines to them so they can start their own vaccination process towards their clients or their patients?
Thank you, Commissioner Mejia. I will provide you and the entire board with a copy of our mass vaccination plan as soon as it is complete. It is not yet complete, but it will be complete by this Thursday, as we received a request from the governor's office yesterday to all local health jurisdictions to turn in their mass vaccination plans to the state. So we are working on both meeting the governor's request as well as your request. So we will have that to you just as soon as it's available for preview. We do have the elements of what our vaccination plans are that I've shared with you, but in terms of the detailed written plan, as soon as it's available, I'll send it your way. And then in terms of your other question about the providers and us giving vaccine, we don't have that role in Thurston County Public Health. That comes from Washington State Department of Health. The providers that want to be able to give vaccine, such as small clinics up to our large hospitals, they have to apply to the state of Washington to be a vaccine provider. The state of Washington Department of Health approves them. That is a rather lengthy process. They are very backlogged with providers. We've about doubled the providers in Thurston County in the last week. There's approximately 30 that we have in Thurston County that have been approved. And then the state allocates vaccine to those clinics. Thurston County Public Health doesn't have a role in being able to allocate vaccine to any other providers. And we in turn have to request our own vaccine that we want based upon our community vaccination plans. And then the state decides how they will allocate those amongst all of the requests that they receive from every provider in the state of Washington. So for example, this week, many providers requested vaccine, and the state was not able to fulfill all of those requests. I believe approximately 40%. So But Thurston County Public Health did receive last week 100 doses, which was the first amount of vaccine that we received. Again, we got that out within just a few days of receiving it and into the arms of qualifying people in our community. This week, just yesterday, we received 800 doses. We will get all those 800 doses that we've received into the arms of eligible people this week. And we hope each week we will request as much as we can distribute, and then we'll see if we're allocated that. So we're trying to scale up, and we have to kind of balance being prepared for when that supply begins to flow, that we will be able to get it out within 7 days.
Robin, I have a question to you. Is there any more information, and this is not, we're not gonna have time to, if there was, we'd have to talk about it a different time, but is there a greater understanding about the congressional legislation that passed? There wasn't flexible funding for counties, but there was targeted public health money that I would imagine would cover some of these things we're talking about. Can the board be briefed kind of on that, what our current understanding is at the right time?
So it's my understanding that the bill that passed in late December included funding for vaccination, that will be coming through the Washington State Department of Health to local public health providers through the consolidated contract. And I have not heard yet the amount that Thurston County will receive. Shelly, have we heard that yet? No, I haven't either. So we're still waiting on both the federal government and the state to tell us what we'll receive.
Okay, well, I'm sure you'll bring that to our attention once we kind of have those numbers dialed up.
Chair,
Yeah.
could I make one comment?
Uh-huh.
I'm hoping that when you folks are interacting with your state counterparts, that you take them some frustrations that we kind of feel from our board, because, well, I'm not going to speak for the board, I guess, but it seems like the state and the bureaucratic process is a big piece of the holdup here about getting things out and efficiencies in place. So I don't know. That's all I have to say, I guess. Thank you.
Thank you. Everyone is really frustrated. I know all of our residents are frustrated. I know the board is frustrated. I know people everywhere that want the vaccine so badly, and we want to be able to give it to them. It's really difficult. I know this is a top priority of our governor. We've been given those marching orders to get this vaccine out as quickly as we can. I know it's a federal priority as well. So again, I thank all of you for your patience and always appreciate all of your questions. And we do continue to advocate for our Thurston County residents every chance that we get at any of the calls that we're on.
I mean, I keep asking the same questions, but it's, when I hear criticism of Thurston County, Washington State, when you watch the national news, it's the same everywhere. And it's not about, I have not identified anything really that Washington State bureaucracy or Thurston County bureaucracy has done or not done that's impeded the flow of vaccine. It seems that the question I asked earlier this morning is the estimates for how much was going to be produced were just not there, and I'm not getting a very good explanation as to why that is. Sounds like it's private industry that's not able to meet their promises. I don't see a failure of bureaucracy yet. That's certainly possible if the vaccine starts to flow and we're not ready, which is why I'm glad to hear all the things this morning that we're doing and that other counties are doing, because we need to be ready. But at this point, I just don't see that this is the bottleneck. And I'm not getting a good explanation as to why we're having the bottleneck. There's more than one company involved. If Pfizer's machines exploded, you'd think that Moderna would be meeting its targets or whatever. I mean, it just seems to be talked about in this vague way with no real specific explanation as to what is, I mean, I think Americans want to know. This is a #1 topic in our country right now. Like, what is happening on the floor of these factories that's different than what they thought was going to happen 2 months ago when they were saying we're going to have, 2 million doses a day or whatever it was that they were projecting. So I'm just really mystified by it, and I'm watching as carefully as I can.
We are doing the very best we can in Thurston County, and again, I really appreciate your support in doing everything that you can to help us be as ready as possible as soon as we have more supply.
What I think I understood you to say at the end, which I'm not sure I completely understood before, is that the supply that we're going to get is dependent on not only the number of people, but our showing of capacity to be able to distribute within 7 days that number of things. So it's critically important that we don't, there could come a point in a month or two where we do fail the community. We certainly haven't yet, and we're not going to because of all the hard work that you've described this morning, but that is certainly an important piece for us to be ready to manage, because we want to maximize what we're able to do for our community. So thank you. Are we good with that item then, board?
Yes.
Yeah.
Let's go to our last item for today. Before we do a break, and it'll have to be a short break because we're a little behind, but let's finish this agenda, which includes one last item, Comcast franchise agreement. Last but not least.
Yes. So we have been negotiating with Comcast, who has been using the county's right-of-way for many years now. We've been in negotiation for about 3 years on the current contract. It will be a 10-year contract for use of the county's right-of-way. Comcast will hold a franchise agreement. It is not an exclusive agreement. And in exchange for these cable communications, the county will collect franchise fees in the amount of approximately $1.6 million per year, and PEG fees, that's public education. I always forget what the G stands for. Government, public education and government access, in the amount of about $100,000 a year. This contract, we've held a public hearing on the contract and received no comment. And I'd be happy to answer any questions that you may have.
Okay, any questions from the board?
No, sir.
No, sir.
We've had multiple briefings on this, including executive sessions, so I think we're good to go. The last items are our standing items where the commissioners will give reports on their activities. The assistant county manager will review our combined schedule, and we will adjourn. Let's take a 10-minute break and reconvene at 10:45.
Thank you.
Okay, you're on.
Okay, we're back in our agenda setting work session for Tuesday, January 26th. Next is item 4 on the agenda for today, which is reviewing the proposed agenda items for next Tuesday, February 2nd. It's a much shorter agenda, so we'll tick through it here. Calling the meeting order at 2 o'clock. Pledge of Allegiance to be led by Commissioner Mejia. Proposed approval of agenda and board meeting minutes going back for a variety of dates, 1 in December and then 3 in January. Although, didn't today's agenda have approval of board meeting from the 12th and the 19th? Yes, so today we're supposed to be approving board meeting minutes from the 12th and 19th. So this may need to be revised, or maybe it's a different board meeting, but that's just a note for staff to take a look at that, make sure that's accurate. Presentation from pretrial services. We will have an introduction of pretrial services diversion officer 2. And that's Nicole Carbone, who we know, but I guess she's taking on a new role, and Marianne will kind of outline that for us. I don't see anybody here, so I can move on, Robin? Mm-hmm. Okay. Opportunity for the public to address the board will then occur. We'll have a county manager's update. Anything to be said at this point? No.
Nothing at this time.
Okay. Then we'll have our consent agenda, which just involves the voucher list that the board will review. And I assume there's no questions as of yet on that future voucher list. So we'll go to department items. Community Planning and Economic Development, the 2021 Thurston County Heritage Grant Awards.
Thank you, Commissioner. This item would approve the Heritage Grant Awards as you reviewed at a recent briefing. These awards would go to many of our local community partners doing work to preserve the history of Thurston County. The total awards for 2021 will be $45,000. They're paid out of our County Historic Preservation Fund. And this motion would also extend the awards that were granted in 2019 and 2020 to continue work. They would not increase the amount of money for the grants, but they would increase time because many of our projects stalled due to COVID-19. The motion would authorize the Director of Community Planning and Economic Development to sign the grant award contracts.
Jeremy Davis is here, and we had a special briefing, particularly on this item. Jeremy, is there anything different in this item from what you presented at the briefing?
No, Chairman, so there is none.
Okay, commissioners, any questions on this?
No, sir.
No, sir.
Okay, thank you, Jeremy.
Thank you.
County manager is the next category 5, and this is a new item for the board, interlocal procurement agreement with the city of Spokane.
Right. So the county, I think in 2016, executed a contract with the Questica to secure a budget development system. Since that time, we have had other jurisdictions reach out to us and ask us to enter into interlocal purchase agreements so they can piggyback off our contract to be able to contract with Questica and not go through an RFP process. This practice of piggybacking is allowed by Washington state law, and the requirement is that the jurisdictions involved execute a simple interlocal procurement agreement, and that the originating jurisdiction followed all legal processes to secure the original purchase. And these are for things, all kinds of things, all types of goods and services can be contracted through a piggybacking arrangement with other jurisdictions. The process saves a lot of time and helps jurisdictions, local government to secure tried and true products. The city of Spokane reached out to me. They are eager to execute the contract with Questica. There is no cost to Thurston County, and this would expedite purchasing for Spokane. So they have asked us if we would agree to enter into this agreement.
Questions, Commissioner Mejia?
I do not have questions.
Commissioner Edwards?
No, sir.
And this type of agreement goes through our legal counsel?
Yes, these agreements have been reviewed by our prosecutor's office.
Okay.
All right. That is the entire agenda for next Tuesday. One consent item and 2 substantive items. So I would ask the board if you would be interested in moving these items either to today's agenda or pushing them out 1 week and canceling next week's meeting because we're not going to have anything else.
Pleasure of the board as to that suggestion.
I'm good with either or. The consent items that'll just be that one budget thing. And is there a time frame thing on your one you just went over for?
The city would like to move as quickly as possible. We have the agreement attached to this item, so it could easily be moved to today.
And it's already been reviewed by legal?
Yep.
Okay, I mean, I don't have a preference one way or the other myself. I'm all for efficiencies and the gift of time.
Can that be in a consent item?
The interlocal procurement, yes, it could.
It really doesn't impact Thurston County, and so, you know, and we do have a pretty lengthy agenda for today, so that's that'd be my preference, I guess, if there's no objection. And then the Heritage Grant Awards, would it be better to push that a week or pull it to today?
Whichever is your preference.
Does Jeremy have a time frame on that?
Jeremy's off, but we can do it today. He's prepared.
Is there a reason to, Josh? I mean, are any of these projects chomping at the bit to get rolling, or can we do it on the 9th?
We can go either way.
I guess I would suggest doing heritage grants on the 9th. We've got a lot on today, and it'd be good to talk about these projects a little bit. And it's an important thing that we do in the community, you know, really good projects. So give us a little more time on that one.
Okay, great. So we'll do that. We'll push the heritage projects to the 9th. We'll take the City of Spokane and put it on today's consent agenda. And we will cancel next Tuesday, February 2nd, afternoon board meeting.
Let Mary Ann know, of course.
Yes, yes, of course.
Okay.
We'll put that on the 9th as well.
Okay, then that brings us to proclamations and awards, item 5 on today's agenda.
Good morning, Commissioners. Amy Davis, Clerk of the Board. There is one proclamation included in your packet today for review. That is to proclaim February as African American History Month. This is in draft form, and if you'd like to move forward, will be included on the agenda for the first board meeting of February 9th. So if you have any revisions, just let me know. That is all for proclamations.
Okay, any questions for Amy?
No, sir.
Okay. Let's move to item 6, advisory boards and commissions.
There is a list of applications today. The 3 applications for the Agritourism Advisory Committee from John Borden, Robbie Rutledge, and Juanita Torman, along with the application from Peggy Kwan for the Civil Service Commission, continue to be included in your packet for review. We have also received an application from Bill Lindstrom for the Historic Commission. Bill would be a new appointment and his term would expire May 30th, 2024. We've also received an application from Nancy Winters for the Surface and Stormwater Advisory Board. SWAB has reviewed her application and met Mrs. Winters during their last meeting. Her application is attached along with a letter received from the chair of SWAB recommending Nancy's appointment for a 3-year term. And it is my understanding from last week that you'd like to revisit these in early February for time to review. However, there is one further higher priority item. So lastly, I'd like to bring to your attention 2 applications for the Chambers Drainage District 2. This is a 3-member board and they've received 2 resignations. Each position has received 1 application for appointment. The first is from Derek Vetter for position 1. Derek has already been involved with the district and was actually a part of their bid openings for their project to clean the ditch there, and was the only one to apply for this position. The second application received was from Marcus Humberg for position 2. The second vacancy was received just the end of last week, and Marcus has been the only one to express interest. The process for filling vacancies on special districts is for the board to appoint a member until the next special election is held for that district per RCW 8538-070 Section 5. In the past, the Board of County Commissioners has chosen to advertise some vacancies. However, because there are currently 2 vacancies and only 1 sitting member, we do recommend appointing Derek Vetter until the next special election. At the preference of the board, we could then advertise the second vacancy for position 2. The district currently has 2 bills, including insurance for the district, that require at least 2 member signatures. And there is also debris that they need to contract out to have cleaned, and they are eager to get that underway. So again, we recommend appointing position 1 to Derek Vetter of the district until the next special election, which can be included on the agenda for 2 p.m. today, and then moving forward with an advertisement for position 2 if you so choose. Are there any questions?
Yes, I have a question.
Go ahead, Commissioner.
If we select one of these 2 individuals to make a quorum on the board, are we, I mean, I don't think I know either one of these individuals, but I don't know, would be placing ourselves in a kind of picking winners and losers or something to do with election? I guess, how come we wouldn't appoint both of them? And secondly, does our legal counsel, maybe Elizabeth or someone, ever review something like this that's very unusual for us to be involved in? And I don't know very much about this, and so I like to have a little bit of legal advice, at least a review, telling us we're making the right move.
Yes, we can certainly appoint both positions today or February 9th if you'd like, and they would serve until the next special election for that district. So we would be appointing them for the interim. And Elizabeth is aware and recommends moving forward with at least 1 appointment so that they can have a majority of the board to sign for invoices.
I guess my question is picking one out of the 2. Are we doing some kind of a favoritism thing there? Because I don't know either one, and I just don't want to have any perceptions that we're putting our hand on the scale or anything like that.
Amy? Oops, sorry.
Yes.
Go ahead, Robin.
So Amy, did the recommendation to do it this way come from the district?
From Elizabeth, from legal
Elizabeth.
counsel, and the district is on board to have at least one member, if not both, appointed for the interim.
And who selected which member to appoint?
So the standing member of the district, who is Kara Bork, she's been involved with the district for quite some time and had first asked that Derek Vetter be appointed for the interim until we received the second resignation at the end of last week as well. So they're ready to move forward if Derek is appointed for position 1.
So they had lined up him to be ready to go.
Yes. And Marcus for position 2, which we can do in February.
Commissioner Mejia, any questions or concerns on this?
My only question is, are these positions, are they open to the public to apply, or is this something that they have to go through, the Thurston County Chamber Drainage District to apply? I want to make sure that there was enough time open for people interested if they wanted to apply.
They must be voting members of the district. And for position 1, which is the position that Derek applied for, they had advertised that position throughout last year, knowing that the prior member's position was expiring and he was not going to run again.
Thank you.
I guess I had the same question as Commissioner Edwards, and I'm still a little nervous or uncomfortable choosing one to appoint. It sounds like it was just an artifact of that. They knew that seat was going to be open and they were trying to replace it, and it turned out the other seat's open too. So I don't necessarily see a reason to not just appoint them both, given that we're in a situation where they can't do business. They're going to both have to go to the special election, and their applications look legitimate and solid. So I've met Mr. Vetter, but I haven't met the other gentleman, but I would say I'd be inclined to just appoint them both. Commissioner Edwards, is that?
Yeah, I agree with you, sir.
Okay.
We will
So
have
unless
these.
Elizabeth says that's not a good idea, I think that's what the board's direction is.
Thank you. We will include these for today's agenda.
Great. Thank you.
Okay, and then as to the other, we've got a couple of old reappointments, not super old, but a little bit old, and then we've got a couple new applications. And what you said, Amy, if I understood you, that we're going to take those up for decision at the early February meeting.
Yes, unless you would like to sooner. We can include those for today as well if you'd like.
February 9th works for me unless the board has a particular reason they want to advance one today.
I don't know when any of these terms expire or anything, so I'm good anytime we can get it on there. So up to the chair's prerogative, it sounds like to me.
February 9th.
Okay with you, Commissioner Mejia?
Oh, February 9th will work with me, Chair.
All right, so let's try to target that as a date for reviewing these and kind of coming to a consensus if we can. Very good. PIO check-in is next. We have a PIO.
Yes. Good morning, Commissioners. Megan Porter, Public Information Supervisor. I just have one update for you. I want to make sure that you saw that the Meet the Commissioners filming for tomorrow, the location and time has changed. It now begins at 8:30 at the TC Media studio instead of 9 o'clock here in room 280. And the studio's at Yager Way, and we need to follow particular COVID protocol. So please enter in the back parking lot, not the main entrance. That will take you directly into the studio that you will be filming in. You will have a temperature check taken upon arrival, and you must wear your mask until recording begins. You will be the only ones allowed in the studio, so no assistants or other staff may attend with you. So I just wanted to make sure that that was clear before the taping tomorrow morning. Pending any questions, that's all I have.
Questions for Megan?
I do not have questions.
I do. I guess the only thing I'd ask, I have no problem with it other than, are we pushing the envelope and going to make people nervous or something because we're causing a problem? What changed or whatever it was going to be here? Or, I don't care. Either way, I'm willing to do it. I'm also willing to postpone it, whatever it takes to make it work.
The studio at TC Media is significantly larger than this room, so it's actually safer for us to hold the filming there. There will only be 3 commissioners and Deb Vinsel in the studio, and it's a very large studio, so it will allow for ample space in between all of you. And so it's actually a safer.
We're not going to get yelled at by our doctor or anything, are we? No. Okay.
Okay, thank you, Megan.
Thank you.
See you in the morning, or we'll see each other in the morning. Next is item 8, legislative update. Robin, how are we handling that this week?
So I see Katie's on, and I don't know if she has anything to add to this item. There are a number of new bills that have been added to this list. I do not have a lot of information about many of them. However, would draw your attention to just a few that are in red. House Bill 1004 is one of the many bills that we see regarding legislative oversight of emergency health orders. You see also House Bill 1017, 1029, and others on this list. And what most of these bills do is limit the length of time that emergency orders can be in place without the obtaining approval of the legislature to continue. I do not have a recommended position for you at this time. Personally, these bills concern me because they limit local governance in a way that may not be appropriate, but we'll come back to you with more information about these bills. House Bill 1016 makes Juneteenth a legal holiday. We would have cost in Thurston County associated with this bill were we to grant an additional paid holiday to our employees. Other than that, we would recommend support of this bill or remain neutral. I particularly, let's see, want to draw your attention on page 5 to a bill that has been added, House Bill 1180. And this is regarding allowing public testimony by virtual means at public meetings. It addresses exactly what we've been doing under emergency orders during the pandemic. However, I do have a concern about this bill because in section 2, there is a new requirement that states the governing body of a public agency shall provide time at every meeting to take public testimony. And what this would mean is that all of your work sessions, all of the meetings that the board holds, we would have to allow time for public comment. That is very concerning, and for that reason, I would suggest that you oppose this bill. House Bill 1201 and its companion bill, Senate Bill 5149, is the funding for foundational public health. This had been one of the governor's Z bills. We are actually in support of this bill. And on, where is it? Turning to, I must have missed the other Z bill that we are opposing, but both of the governor's bills got permanent bill numbers. It may have been on the list last week. That is just a very brief overview, and I think that a good plan would be to take another run at this very briefly on Thursday morning at your check-in meeting.
Sounds like a good plan. Any questions just based on what Robin presented here this morning?
No,
we'll
sir.
take it up Thursday if it's something deeper.
No questions.
Nope.
Okay, very good. Thank you, Robin. Keep this handy, and Ramiro will probably be with us Thursday. That takes us to item 9, which is briefing public hearing decisions pending, and the item there is special use amendments, development code, docket items. Says briefing January 20th. Okay. Yep. We have Maya, Jennifer, and Andrew Bond, who just popped on the screen.
So commissioners, you have received briefings on the 2020-21 development code docket, and we are asking the board to provide direction to set public hearings or request additional information from staff.
Okay, so I guess this is just kind of the tying up what we covered last week. To Commissioner Mejia, anything you needed additional before deciding whether to move this forward to public hearing, or questions?
No.
This is commercial smokehouses,
Daycare facilities.
daycare, and resorts.
Resorts and retreats, yeah. I do not have questions at this time.
Commissioner Edwards.
No, I'm good to go forward with them.
Okay, I am too. So it looks like Commissioner Mejia, are you comfortable with the public hearings moving forward?
Yes.
Okay, so you have 3 thumbs up to advance the items. Good work, guys.
Thank you.
Okay. Then we're to commissioner items. And first is designation of a potentially dangerous or dangerous dog. And I don't know who's setting this one up.
Good morning, Commissioners. Katie Johnson, Executive Assistant to County Manager Ramiro Chavez. He's asked me to brief you on this matter. I spoke with Elizabeth, our counsel, about this, as we have a couple different directions that we could go to. Just to give an outline, we've had a couple complaints for neighbor's dog that was on Ursula Lane in Yelm, Washington. There have been several complaints of injured farm animals, pigs, an alpaca from a family who was injured so severely that they had to euthanize the animal. Reports of these dogs running after chasing kids on bikes, chasing cars, and just being generally dangerous to their neighborhood. So there's been quite a few complaints against these specific dogs. So I've spoke with council, as I said, and we at the county have a code which is a potentially dangerous dog or dangerous dog. Commissioner Edwards and Menser, I believe we've kind of gone through this before a couple different times. Potentially dangerous dog is when the board can classify them sending a letter to the dog owner deeming them potentially dangerous under code 9.10.070. And we would write the owner a letter designating these dogs as either potentially dangerous or dangerous, whatever the board may choose. I would like council to take a further look at the complaints and possibly bring this back Thursday for your decision on that. But as it sits right now, we can look further into the matter. It seems as though that they are quite a nuisance to the neighborhood. Again, what happens after this is the owner of the dog then has 10 days to review and file an appeal to the board after we declare potentially dangerous or dangerous. If they do not, then they have to keep the dogs within restrictions, and if any violations are made, then Animal Services has to take it into their hands. Do you have any questions for me? I know that was kind of a lot.
So the proposed procedure is to have a board discussion on Thursday after we review all of this.
A quick discussion to deem whether it would be in fact potentially dangerous or a dangerous dog. And that's just for council to go over to determine, just due to the fact that the dogs did injure an animal so severely that they in fact had to euthanize the animal. It's kind of a fine line walking there. So we do just want to get her confirmation on which it could be.
Questions from Commissioner Mejia?
So what I'm hearing is we have Thursday, we're going to set a special session to go review this.
Not a special session, just to confirm whether we would declare the dog as dangerous or potentially dangerous if the board pleases.
Okay.
Elizabeth's going to be part of that, you're saying?
I can get either Elizabeth involved or just brief you on her overview of it if you'd like.
Commissioner Edwards, any questions about, I guess we're discussing process at this point.
Well, my only question, I guess, is it looks like they're looking to go after the county for the damages or something is that
sorry,
right?
Go ahead.
No, go ahead.
It was brought up in emails. I've had contact with one of the complainants, and they did want to just go forward with bringing the complaint to the commissioners to have the dog declared dangerous or potentially dangerous. I will discuss that with Elizabeth if they do want to go forward with that. But in a phone conversation I had with one of the complainants, that was not brought up.
I don't have any problem declaring the dog as a danger. Unfortunately, they're living out there where that could have been a cougar do exactly the same thing, and we wouldn't have any involvement there. I mean, I really think it's up to owners of animals to do what they need to do to protect them. But I don't have any problem if the dog's what it appears to be. I'd like to hear a little bit more from the dog owner, I guess, but it sounds like he might be disappearing. Do we have anything from that person?
From the dog owner, we do not. And at that point, I believe once declared dangerous or potentially dangerous, then they would have an opportunity to appeal that. So you would hear from the doctor themselves at that point if they chose to appeal.
If that's a normal procedure, I'd go ahead and go that route would be my preference, I think. Without knowing any more or hearing from Elizabeth, I guess I would like to hear from her.
Okay.
Okay, so are we dealing with, I only skimmed this really fast, and I'll read it all before Thursday, but is there 2 dogs that are, I mean, I see reference here to 2 dogs and 2 dogs killing, and are we,
It does.
are they asking for declarations on 2 separate animals?
It does appear to be 2 separate dogs. Like in a case we had recently, there were 2 dogs that had attacked a pet, not killing the pet, so they were declared potentially dangerous, but they were owned by the same owner. So the potentially dangerous or dangerous dog would go to the same owner on both dogs at the same time.
So it's the same owner is what I'm hearing, right? For 2 different dogs.
Yep.
It does say I am claiming reimbursement from the county losses I have suffered. I mean, I know they're getting a bill that they don't like, but I don't know that it's the county's responsibility. And I wonder about moving forward one way or the other with litigation pending, that's all.
Correct. I do believe that Animal Services did advise one of the complainants that they could take this, could take the owner to claims court for that, but I'm not sure how that conversation.
Sure, well, that's fine. I just don't want to expose the county.
We have a process if anyone wants to claim that they had costs incurred due to a county's action, we have a claim process that we could certainly provide. That does not guarantee payment, but we do have a process in place where someone can submit a bill to the county and our risk management considers whether or not to pay it. We could offer that to these owners, but just because they sent us a bill would not mean that we would pay the bill. Like, I would not process one of these bills for payment.
Thank you.
Okay, so I think we have board consensus to take this up Thursday morning with some input from Elizabeth on exactly what the category, we need to go through the code because we have a decision to make about potentially dangerous. They're different predicate acts that justify those designations. So, and Commissioner Mejia hasn't even seen one of these before, so we should definitely walk through that step by step. Okay, thank you, Katie.
Thank you. Yep.
Then that will bring us to item 2, Water Conservancy Board.
Hello, Katie Johnson again. So I'm also briefing on the Water Conservancy Board. The remaining member, Chair Jerry Lufane, emailed last year. This may look familiar to Commissioner Menser and Commissioner Edwards. Commissioner Mejia, this came about before your time, but we'll brief it real quick anyway. So the board had discussed dissolving this Water Conservancy Board. It seemed as though there was only 1 member out of the 5 that were still remaining, and none were trained up to be a part of the Water Conservancy Board or to keep it going. The last meeting was October 2018. It looks like the only thing remaining of the Water Conservancy Board is a balance in their bank, which would come back to the county. Also a PO box that's been extended for some time. This did come to the commissioners last year where we were in a pandemic and it didn't fall under the necessary things that we could take action on. So it's now coming back to the board. We have a resolution that I believe is provided there. The steps that the board can take are that we have to provide notice to dissolve of dissolution to the Department of Ecology, the Director of Ecology, sorry, they shall have, the Water Conservancy Board shall have 30 days to respond after adoption of a resolution of dissolution, and the resolution, the Water Conservancy Board shall become effective 30 days after adoption. There also is an optional step to hold a public hearing for this. It's not required, but if you wish to, then the county has to post newspapers not less than 10 days and doing the proper posting with that. As I said, it is not necessary, and that's per our council. So
I do have a question.
Go ahead,
course.
Commissioner Reese.
To the chair, I guess, did you serve on this at one
I
point?
did. So did Josh Cummings.
So then that's the same thing I've heard about in the past, so I'm going to listen to you rather than me say anything, because I don't know anything about it. So I'm interested in what you have to say at some point.
The Water Conservancy Board is an interesting creature. It doesn't really, like all of our boards, they're all kind of different in why they were created and what they're trying to accomplish. This was formed by, it was really resulting of a backlog at Department of Ecology on water rights transfers many years ago. And the legislature set up this system where you could train a board of citizens, and you do like a whole week of training on water law so that you can basically process, and you don't get to do new water rights, but you can do transfers and certain types of lower level water right transfers in order to try to, and you basically work through the application, do the analysis, write a report, somebody at Ecology reviews it and rubber stamps it. And it was intended to kind of move these applications along by letting citizens get involved. So Thurston County always kind of struggled to have enough applications. There was a big, back before I was on the board, McAllister Springs, there was a thing with the brewery. There was a couple flurries where there was a lot of work and a lot of applications. By the time I got on the board, that had all kind of cleared, and we had 2 or 3 things going at a time, kind of a steady stream of work, but nothing major. And then that work just kind of trickled out. And the board members, which, I mean, we had 5 board members plus 2 alternates, and we were fully staffed the whole time that I was involved, which was 2010 to 2013, 2014. Josh was on there overlapping me a little bit, and he continued on, but they just, there wasn't applicants, and then there seemed to be a loss of interest. So, and that's been going on for a while. So I'm comfortable dissolving this. I'm not sure I tracked, Katie, everything you were saying about what we need to do next.
So the minimum steps, and that may or may not have been included, but I can read over them real quickly. Minimum steps to dissolve the WCB would be the BoCC must provide notice of dissolution to the Director of Ecology. The WCB shall have 30 days to respond after the adoption of the resolution. Number 3 would be the resolution dissolving the WCB shall become effective 30 days after adoption of the resolution. And number 4 would be the BoCC may reverse the dissolution based upon the WCB's response. So if Jerry, unlikely, would like to reverse the resolution, then the board could do that if they wished. But he is very open to dissolving the board.
Yeah, Jerry's an expert in this area, and he's been on the board for a really long time, and he's requesting this. So it sounds like the board would need to direct maybe Ramiro to draft a letter to Ecology to give them the notice that we're going to take action in 30 days or longer. Is that acceptable to the board?
Yes.
Yes.
Okay, then let's 3 thumbs up for asking the county manager to put the wheels in motion, so to speak, which sounds like notice to Ecology is a first step.
Yep, great, thank you.
Okay, thank you. And then we have this in our packet, there was this statutes on budget. Is this about the Water Conservancy Board, or is this Money is just a different topic.
This is an item that has come to my attention. This is regarding an item that came to my attention quite late that I'd like to add to this morning's agenda regarding the coroner's budget. So
Okay, let's get to that now.
yeah. It has come to our attention that the coroner has exceeded his expenditure appropriation by $1,700 so far. And his total budget was $1,113,228. They currently have about $1,700 in bills that need to be paid. When I look in our financial system, he's already overspent by $240, which isn't much, but it is over. And I've provided you these RCWs. It is actually an extremely serious matter for an office or department to exceed their appropriation. And I provided these RCWs because Commissioner Mejia has not been through this before. If you look at the first one, RCW 40 or 364100, is about the board adopting the budget. This is where you set your appropriations. And on the fourth row down, it says, every county official shall be limited in the making of expenditures or the incurring of liabilities to the amount of the detailed appropriation items or classes respectively. In Thurston County, we budget by fund and officer department. So the appropriation to the coroner was 1.3 million. The law goes on to say in RCW 3040.130 that that any expenditures in excess of the appropriation shall not be a liability of the county, but rather that it becomes a liability of the official that exceeded their budget. And that this says the county auditor shall issue no warrant and the county commissioners shall approve no claim for expenditure in excess of the budget appropriations. So this is a serious matter. The coroner was actually, when I reviewed the expenditures for the year, they had spent less this year on supplies than they usually do. They had had additional need for extra help hours being used by the staff. But what really put them over the top is there were an unexpected number of, I believe, of autopsies that the coroner had to pay for. We had adjusted the coroner's budget last year. We covered COVID costs in the amount of $17,840. In Amendment 6, we knew that the coroner did not have sufficient funding, and we added $15,000 to his budget at that time. We had thought that that would be sufficient, but he is currently $1,700 short, and we have a few more days to go before the fiscal year is closed for payments. The county has never, to my knowledge, left an official holding the bill for exceeding their appropriations. And this is not the first time that we've been in this situation. In the past, we have put substantial amounts to cover over expenditures for public defense. Fortunately, they are on much more stable ground these days. We've had over expenditures by the prosecutor, the sheriff, the coroner, and this is something that the board has a proviso for in the budget that allows us to transfer money out of non-departmental appropriation to another officer department to cover costs from the general fund. So I've been talking to financial services, and we're trying to determine if the best strategy is to transfer about $2,000 in authority to cover the coroner, or if, like we did last year, we have the coroner bill non-departmental for part of his costs to keep him under budget. But we need to take an action so that the coroner has not exceeded his appropriation.
Okay. Questions, Commissioner Edwards?
I guess my concern here is that we budget them so low that they don't have any extra to cover the extra cost of doing business, whether that's inflation or whatever. I mean, if we aren't aware of any abuses and we knew we had to give him more money, I'm all for trying to make him whole in some fashion or another that doesn't get the county in trouble. So I don't know how to do that because that's not my expertise, but that's where I'm inclined to go with this.
Anything?
I don't have a question, but a comment. I did speak with Coroner Warnock last week as our monthly check-in, and you know, he did explain this, and he did say it was mostly due to the unprecedented number of suicides there were. Those are more expensive, and so those added up quickly. And so like I'm basically on the same as Commissioner Edwards. I think, you know, it's hard to budget out for that. So I have no issue with it whatsoever, especially since last year really was an unprecedented time, and the fact that each department had to carry that 2% budget cut. So that's where I stand.
Yeah, Commissioner Ty, could I make another comment on that? I'm going back as some briefings back early on. It seems to me the coroner I asked a question at one of our meetings. Have you got anything directly associated with the virus? And it seems to me there was maybe several suicides at the time that were somehow directly related. I think one of them included a note that the party had left. So I think we're on pretty solid ground to hang our hat there, if my recollection is correct. Because how do you pin something down if you don't have anything really to pin it? And there's an example. I'm not saying all of them were or weren't. I'm just saying I think it would be safe to mention we're in exceptional times. And I think the coroner's been very good about staying on top of things. But when we keep them so tight that you just can't make it work, you just can't make it work. So that's where I am.
Oh, sorry.
No, I'm done, sir.
Robin, just so I completely understand the issue, at RCW 3640-130 says that the county commissioner shall approve no claim for any expenditure in excess of the detailed budget appropriation. So if I understand you, the proviso you described, so we sort of built in a safety valve for ourselves, because if we were to make that shift, we would still be we would be approving a claim for an expenditure that was within our, budget that's laid out. Okay, so you're saying that that's one option, and then what was the other option? So there were two options?
So the other option is to have the coroner take one of his bills, like one of the autopsy bills, and charge it to non-departmental. And that's what I think we did last year. And the problem with that approach is that it understates the cost of the coroner's office in the long run. I know $2,000 doesn't seem like very much, but it doesn't create a foundation for us to, acknowledge the full cost of the office. And then, as Commissioner Edwards was saying, we do budget the coroner very tight. And when you don't have the correct historical numbers, it's hard to estimate how much he really needs in the future. But we can just charge one, or a few of his bills that add up to $1,700 to non-departmental.
It seems to me that the law is so, I understand why budget laws are, are important and they're strict and they're, but you've got departments, public defense is the one that we constantly, when you have departments whose expenditures are dependent on things outside their control, it seems really unusual to have this kind of, super strict set of rules, because how could you 100% of the time always be able to meet it? So it seems like the legislature has set up a system whereby we have to build in these little tricky end arounds. And I'm not trying to say that pejoratively, but I can't imagine that. It's creative and I understand why it's permissible and legal, but I also don't like legal schemes that are set up to, require trickery or whatever, which is kind of seems like how this is configured, and why they didn't come up with a better mechanism for dealing with those things that are outside department's control.
So with all due respect, because I believe our county managers do manage very well, but I worked for the state of Washington for 26 years that has a much greater restriction on appropriations, and the penalty includes jail time for the head of an agency that overspends, and I never saw an agency overspend their budget, and they do not have but one supplemental budget a year. So it can be done. It requires active management and a certain amount of foresight. In this particular case, we knew that the coroner was in trouble, especially after the 2% budget reduction last year, which is why in amendment number 6, we added $15,000 to the coroner's budget. We thought that would be enough, but he got this unexpected bill at the end of the year, and here we are in this situation. But this should be extremely rare. We've seen it in this county more often than we should.
Okay. Yeah, well, and public defense is a unique species because most groups can, the Constitution says that defense has to be provided, and a team of lawyers, there's nothing else to cut other than the lawyers who provide the defense. I guess you can double up on case loads and stuff, but anyway, that's beside the point. It seems like the board is giving you thumbs up to find the best way to meet the additional expenditure for the coroner's budget.
Yeah, thank you.
Okay, and I wanted to point out, as my assistant texted me, that we deferred a couple of items for Thursday's commissioner check-in, and we don't have a Thursday commissioner check-in this week.
You don't?
So I don't know that any of those are I've got Salmon Recovery Council starting at 9:30. that might have been the reason. We talked about the dangerous dog issue and the legislative update. So those might need to go somewhere else.
So we can certainly defer the legislative update. The dangerous dogs, let me check in with Romero, who is staying on top of his email today.
Okay.
And see where we should move that.
If we could have, I mean, if we need a half an hour at 9 o'clock on Thursday, I'm available till 9:30, but at that point I'll be out of commission for most of the rest of the day. Okay. That takes us to item 3, 10, subsection 3, public testimony. I don't know if there's anything in that bucket.
I have nothing for you.
We often don't have anything. And then that brings us to commissioner items, which we have 13 minutes if any commissioner has a burning item that needs discussion this morning. Commissioner Mejia, anything?
No, I do not have anything, Chair.
Commissioner Edwards always has something for us.
No, I'm going to surprise you, Mr. Chair. I'm not going to have anything for you at this point because you can't do it justice in 10 minutes, most of anything. And, you know, it's just one of our situations that seems like the gift of time will be worth a lot because probably won't get anything accomplished in that 10 minutes anyway. But no, I'm good. Thank you.
Okay, very good. I do not either. So it's 11:48. We'll be back in session for our board meeting at 2 p.m. Robin, are we good to adjourn?
Yes, we are.
Okay, we're adjourned for today, this morning. Thank you.